What nutrients may help to improve the chances of pregnancy?
It's a really good question. It's a little bit, it is broad in that sense because it's very, as you know by now,
Yes.
it's very specific to the
Mhm.
person. But I think on a general standpoint, prenatal vitamins, multivitamins, and omega-3 fatty acids, the ones that have a 2-to-1 ratio of EPA and DHA in their makeup, those are great foundational nutrients for anyone looking to get pregnant, have an adequate amount of nutrients as they, go through their pregnancy. And it's also great for sustaining good postpartum health. Um, Consuming prenatal multivitamins and omega-3 fatty acids are a reliable way to access beneficial nutrients during pregnancy. Obviously, we don't want to discount the macronutrients that you see in food like carbs, fats, and proteins. But right now we're talking about the micronutrients, right? So these are your vitamins and minerals. So a comprehensive prenatal would include folic acid, iron, vitamin B12, calcium, and they're consumed every day as a that's a general recommendation, and they're essential in your baby's growth, addressing the potential risk of birth complications, birth defects, anemias, and other things, and it can even be taken before you even start to actually actively conceive. Yeah. However, not everyone's going to be benefiting from the prenatal regimen that I just mentioned. So these are, what comes to mind are like people who may have iron metabolism issues that may increase someone's storage of iron. So that may lead to iron overload, which is not great. People who may have hemolytic anemia, which is a blood disorder that causes red blood cells to burst. So that's not great either. And then there's also people who may have stomach ulcers or gastritis, which is a type of stomach irritation. So, all these things, primarily things that may affect absorption, proper absorption, and safe absorption of these nutrients. If you suspect that, then you may want to think twice about just consuming prenatal vitamins or minerals. Also, not everyone may benefit from prenatal multivitamins from the get-go. Some people may need extra help before they do that. So they might need help in ensuring that their bodies can optimally absorb nutrients. They have little to no significant physiological obstacles that will impact their reproductive health. So, for example, it may make more sense for some people to actively work on their PCOS or hypothalamic amenorrhea before we even incorporate a prenatal nutrient regimen. So it's as specific as it goes, but there's also, I think a lot of people are great candidates for a general prenatal regimen.
You're right. Every patient is different, so you do have to look at the specific case to see if that vitamin itself is good. Thank you
Yeah.
for that.
Oh, no problem.
So, what does your preconception care plan? How does that work?
Yeah. So the goal with preconception care planning is to optimize and prepare the body for conception. The intention of preconception care work is finding out how to best address your unique fertility challenges, and take care of your body so that you or your partner, if it's applicable, are nourished and prepared for pregnancy, parenthood, and beyond. So if you or your partner are ready to get pregnant, you get started with preconception care around 3 to 6 months before you plan to actively conceive. And this is to account for the just the nature of the sperm and egg cell growth and development, right? So you want to be able to kind of meet them where they're at. So that's like 3 to 6 months before you actually get ready to actively conceive. And then this time, like, it gives us a lot of time to identify some of the roadblocks you may be facing, as well as incorporate evidence informed interventions that may help to achieve a successful pregnancy. So what that looks like is, my patients and I would have an initial fertility assessment and planning, wherein we would go over, we would do a deep dive at their health history. We may review labs that they may have on hand, and I do interpret them so that they have there's more depth to what we're talking about. The physical exams that are focused may be performed, and then we come up with a management plan, an initial step to address their fertility challenges. Of course, the care doesn't stop there. We do have follow-up fertility kind of strategy sessions that do involve reviewing lab work that, if we order them initially, then yes, we would be interpreting that. We will review things like, how they respond to treatments, or we may modify some parts of their prescription plan. We may discuss any new information that they may bring up or findings. We may perform acupuncture as well, and on a weekly basis, or however we determine the best plan is for them. But we would continually refine the management plan so it always meets their goals and it meets where how their body is at that point of time. I am super excited about my preconception care plan because they're really great touch points for people to get acquainted with integrative healthcare. And it's not just for themselves to keep healthy and well, but it's also for their growing family. So kids can get care as early as when they were being conceived, right? So, and then that carries on, and we there's some interesting research about care, pediatric care, and pediatric health overall, and how far in advance they're getting the care from and the outcomes of that. So it's kind of putting two and two together. It's like more reasons for me to kind of present this to people who may need it, because it just has a really fascinating trickle down effect, and which is great. So yeah.
Yeah, no, you're right. Because just integrated healthcare itself, there's so many aspects to it. And it's great that you were able to kind of explain and give us some insight into that. So thank you.
Thank you.
When we talk about supplements, are they the way to go? And if so, what are some recommended supplements?
Another great question. And I think there's so many potential answers to that. I don't necessarily think they're the way to go. I think it depends on what we have in front of us, right? So again, it's a very individual scenario that you have to look at. You can't necessarily compare one person who has a similar condition to you to what you're going through, right? However, with all things aside, if we're able to kind of address the foundations, like, are they eating well? Are they in a, is someone getting the necessary social support system that they need? Like, are they in a healthy relationship? Are they sleeping well? All those basic, not so basic things kind of addressed. I think supplements have a role to play, and I think targeted supplementation can be quite fundamental in going about someone's preconception and pregnancy journey. So yeah, I do have like some supplements, nutrients, micronutrients that I think, again, on a general standpoint, a lot of people can benefit from, especially when they're very specifically used. So I think an obvious one at this in this current age is vitamin D, especially in Canada, vitamin D3 specifically, because that is the most usable form of vitamin D. It is something that a lot of people are deficient in, and from the more I practice, the more I realize how involved vitamin D is in so many body systems, not just reproductive health. It's also involved in immunological health, and checking for vitamin D3 levels. D levels is something that can give you a good idea on how, obviously how deficient you are, but what kind of dose you would really benefit from. So I know a lot of people I talk to, they're already on vitamin D, but they're underdosing, or they're not really dosing enough to get to levels that would actually get them to good health, or good reproductive function, if anything. So that's one place to start. Maybe that's something you can take away. Like, yes, vitamin D is good, but I think checking your levels is essential to ensure that you're actually getting the dose that you need. Because yes, having sufficient vitamin D levels is it does affect the way you respond to treatment. It affects the way your hormones kind of interact with each other and affect your ovulation and even sperm health and all that. But yeah, it has so many it affects so many body systems, and I think it's it's crucial to just get a sense of that. I'll have two actually to share. One supplement that I tend to recommend is also I think generally safe for a lot of people. This is called myo-inositol. So it is a sugar. Structurally it is a sugar, and it is also called a vitamin B in a sense. It's like the vitamin B8 or something. But it is something that functionally it helps your cells to become more receptive to hormonal changes, but more importantly, it makes your cells receptive to insulin. So it is something that I often incorporate for PCOS patients specifically, but I find more and more it's very helpful for people who might have thyroid disorders. And even things like endometriosis. So it is, when used in the right time, in the right place, it can actually be a game changer for a lot of physiological markers that need help supporting. It is because it is a sugar, and it is generally dosed high. I think not a lot of people may get that warning that it can irritate the gut, the intestine. So you might get diarrhea from having higher doses all at once. So you kind of get your body acquainted with it. And the right way to dose it is to just kind of start slow. And then once you start to build a tolerance, then go for the full dose. So that may help a lot of people. I know I have a lot of smart patients who start themselves on it, and it's like they're discouraged because of this side effect. But really it helps to have that sense of tapering, or have that, you tighter your dose so that it doesn't overwhelm your body. So maybe that'll help some folks out there. And I guess another thing about inositol is that it, when you're poorly tolerating it, that might also give you that might also give an impression that maybe your gut isn't doing so well too, right? Because if you constantly have digestive disturbances, you might just not be absorbing things very well, right? So that's another avenue that you and your healthcare practitioner may explore, that maybe this is the priority, right? Like you may benefit from inositol another time. Let's work on this first. So, but yeah, inositol is a great kind of foundational nutrient that I think a lot of people already start themselves with. Again, the other supplement I am happy to share as well, that's I think a lot of people can benefit from, is curcumin, or it's a medicinal ingredient from the herb turmeric. So a lot of people may hear about this and actually use them in their cooking or their smoothies or whatever. But it is a spice. But curcumin specifically is the one of the active ingredients of this very, very powerful herb, and it is indicated for inflammatory issues. It is also it has quite an interesting reputation too, not in a bad way, more so in a very it has a lot of potential. So it has some interesting evidence on affecting things like in the cellular physiology world, we call this apoptosis. Basically, it has a significant influence on the growth and development of tumor cells, or cancer cells as well. So it does have a role to play in immune health. And I like incorporating this for things like endometriosis, or maybe complicated PCOS conditions that have a lot of inflammation in them, or someone who may have a lot of the signs and symptoms of this concept called estrogen dominance. I don't use that term a lot, but it's an easy way to kind of tell people that, okay, this might be what's happening. Not necessarily that you have too much estrogen, but there might be something going on with how your body is processing estrogen, right? But and so I've used curcumin a lot safely in specific doses, though it has to, I think it's very individual. But yes, it is something that, yeah, you can find in your kitchen or in grocery stores. You can have a little bit of it every day, see if it makes a difference in your symptoms. I wouldn't take this during pregnancy. So if someone out here is watching this video and you're taking curcumin and you get pregnant, great, stop taking it. Just because it's not, we don't know its safety profile during pregnancy, and we'd rather not, we're a little bit more conservative when it comes to herb usage in pregnancy. So yeah, so some of those supplements that I generally recommend at this point. Hopefully this gives you some insight.
That's great information. Thank you so much for sharing. Several different choices to choose from, and like you said, having that discussion with a naturopath and going over your unique kind of personal issues that you may be having with digestion. The dose and different nutrients can vary.
Yeah, for sure.